worried about pain in your hip turning into arthritis as soon as you get into your 60s? This is a big concern for a lot of clients here coming to West Chiropractic, suffering with problems in their hip or in their back. They're unsure where it's coming from, but they're also really concerned about what's going to happen in the future. They want to stay active, mobile, keep moving, exercising, and they don't want to make the same mistakes as the people older than them who are lacking mobility and not being able to stay active long term. This is a serious concern with hip arthritis. Although you can have very successful surgery, we want to try and avoid that at all costs, because at the end of the day it is surgery, there are risks, and there also is a long recovery time to get back to where you were. So if we can start doing the work now, it's going to prevent the hip from causing problems in the long run. We'll talk to you exactly what hip arthritis is, what are some of the risk factors, what to look out for if you think you are struggling with hip pain, and also how to prevent hip arthritis in the future. My name is Dr. Jeremy Andrews. I'm a doctor of chiropractic here in Surrey at West Chiropractic. I'm really looking forward to this one. Stay tuned. So, what is the hip? Well, the hip is a joint that comes out the base of your spine. So if you look here, you see the pelvic brim. This is then the hip socket in there. So it's what we call a ball and socket joint. There are other ball and socket joints in your body, like the shoulder. The shoulder can move in lots of different directions. Same as the hip, it can move in many, many different directions. So this is great, or is it? Shoulder joint's moving well, hip joint is moving well, means you can go from side to side, we can run, we can walk up hills, we can move our legs around, twist our bodies. Ball and socket joints are fantastic, but if they're not in the right position, they can obviously be very detrimental. This is where a lot of arthritis develops, especially in the hip joint. The reason it's more common in the hip joint than it is in the shoulder joint is purely because it's more of a load-bearing joint. Now, we see a lot of people here who like walking, they like running, they play tennis, play golf, do lots of exercise in the local area. If you're in this area, you'll understand there's probably more golf courses than there are people. No, I'm just kidding. But there are a lot of golf courses, so a lot of golfers. And obviously golf, you're walking 3, 4, sometimes more miles every single round. If you're anything like me, you're probably walking 6 by the time I picked up all my balls and zigzagged all through the fairway. Now, that's a lot of walking, that's a lot of stress on your body, especially if you're carrying a bag as well. So the hip tends to take up more stress. Now, if the hip is not in the right position, it's obviously going to cause the joint to start wearing out. This doesn't happen overnight. This is something that takes a long period of time. But it is really, really important to make sure that you're looking out for the early warning signs of any hip problems. So what we'll do now is let me show you exactly how the hip works, how it moves, and then we'll go on to some of the things that can cause it to come out of position. Okay, so these are the hips here. Now, a good way to start sort of mobilizing your hip is to have one leg lying on the bed or on the floor. I tend to do it on the floor because it gives you more of a hard surface to give feedback on. The bed or the sofa is too squishy and you're going to have to get some stability. So you can really test your range of movement with your hip just by doing circles like this. Do one way and then one the other way. Okay, fine, everything's okay. Now, if you've got any clicking, particularly when you're running your leg down like that, that'd be sort of 1 point. I'd be marking that down and saying clicking when I'm lowering my leg down. The other thing as well, turning your hip out like this, okay? And then like this, if you've got any clicking on the inside of your hip, again, marking that down as 1 point. Another thing you want to do is try and test the internal rotation. So if you see my leg there, I'm just moving it to the side, and I'm trying to turn my hip in, so squeezing the inside of my hip. Any pain there, another point, and then turning the hip out like this, so bringing sort of that leg across the body like this, and then bringing the leg all the way up. You can hug it into your chest. If there's any problems with that as well, again, 1 point. So if you're scoring any more than 3 on that, it's likely that you're gonna have some sort of hip issue where there's something going on in the hip. Well, what could it be? So if you score over 3, you're having pain or you're having clicking in certain areas in the hip, what is the problem? So very commonly, the pelvis is a large joint here, and very commonly it can come out of position. So what can often happen is the SI joints, those are the sacroiliac joints, these bits you see on the back here, loads of ligaments around them. This is a load-bearing platform. So think about the foundation in your house. This is where everything sits on through there. Your spine sits on there, the hips obviously come off the side. So for you to sit comfortably, to move comfortably, this needs to be in a good position. So the pelvis can move from overpronation in the feet, causing the knee to come out, hip to move, causing the pelvis to be unstable. A lot of common pelvic instability issues we see are in mothers that have had kids. Not necessarily straight away after the kids, but 5, 10, 15 years down the line. The body has taken a lot on it from a pregnancy, a labor, maybe 2, maybe 3, maybe even 4 or more. And that can cause a lot of toll on the body if it hasn't been reset afterwards. So when the pelvis rotates, puts a lot of pressure through the hips. Generally mothers and fathers in their sort of 40s, 50s, 60s are wanting to get back into more exercise once their kids are getting a little bit older. I speak from experience. You have that sort of 2-3 year window where chaos, kids turning into toddlers, and then suddenly things start to get back to some sort of normality and you want to get back into exercise. But your body has been sedentary or it's taken a lot on it from going through a pregnancy. So it's important that we've got that pelvis in a good position to make sure the hips are stable. How does hip pain manifest? So your typical hip issues are going to be from glute tightness, pelvic instability, piriformis problems. So your glutes, these are the muscles that run across the back of the pelvis here. They go all the way from the middle of the spine, this is your coccyx here, all across the back side of the pelvis and around into the hip. They move the hip backwards out to the side. They're big stabilizing muscles and big powerful muscles. So if these aren't working well, they can cause pain in the back of the hip, around the inside of the SI joint here as well. That can be sort of a dull ache, particularly when you're going up hills or upstairs and causing problems. So we need to make sure we're having a look at what the hip and the glute is doing when these are not working properly. The second muscle is more in depth. So that's a piriformis muscle. So you may have heard a physio talking about piriformis syndrome. Piriformis runs across here and then round into the hip, and it turns the hip out. So we call that external rotation, so turning it out. So often you can see someone, they're walking, their hips sort of move from side to side. That can often indicate some piriformis instability or some glute instability. So it's important that we get that piriformis loosened off or activating more. Tends to be hyperactive, so very tight. So we need to get that loosened off. Okay, and then the third type of pain you may get is a pain on the inside of the groin. So going into the groin here. Now, that is more of a warning sign. That can be causing problems with hip arthritis. Your typical hip arthritis is a sort of sharp shooting pain right into the groin. We see this a lot in people over 50. They've started with some back pain and the pain sort of refers round and goes into the groin. There is a referral pattern from the base of the spine here, and the nerve will come round into the groin. Also the SI joint, the sacroiliac joint, that can refer pain into the groin. It can refer pain into the male genitals as well. So we need to be addressing which one we think that is. So that's why we take an x-ray. So we take an x-ray to see exactly what the hip looks like. We can see for any hip arthritis. We can see for the gaps getting tighter around this ball and socket joint here. And then we can refer out if we need to, if we think someone's not going to respond well to any care and they're going to need more in-depth analysis, or potentially refer them for hip surgery. We try and avoid that at all costs and try and do as much conservative work as we can. But if that hip is too far gone, and it is in about 10% of the cases that we see, we just want to make sure that we're getting that hip sorted. The success rate on a hip replacement is very, very good. And it means that they can come back, we can rehab them, get the body in the best position to allow them to get back to activity as soon as possible. If you have these pains, so let's say you're getting problems with the inside of your groin and you're worried long-term about developing any hip arthritis. What are some of the things you can do to prevent that from becoming a problem long term? Well, luckily we deal with this every single day here at West Chiropractic. So I'm going to talk you through our top 2 exercises if you think that you've got hip arthritis or you're worried about getting it in the future. Okay, so you need to get some of these bands. So we have these here in the clinic, but you can get them on Amazon and they're pretty inexpensive. Getting a selection is good because it gives you different resistances. So it goes from light to dark. So yellow being the easiest, then it goes to red, blue, so green, blue, and then black is the hardest. So I'm going to start just on a middle one, like a green. So what you want to do, they've got clips on either side. You can use thicker bands as well if you want, but ultimately they need to provide a bit of resistance. So I'm just going to do them like this, and I'm going to cross it over like this. I'm just going to put my legs through here, and you want to be sitting down for this because you don't want to fall over. It's going to cause problems when you have problems if you've got hip pain already. You don't want to have a problem with your elbow or your shoulder from falling over. So we call this the clam exercise. It's a lovely exercise to take some pressure off your hips. So make sure you're lying down, have your head supported, either have a cushion, and make sure your legs are at 45 degrees. So this, remember, if you've watched my sleeping position video, this is the perfect position to sleep in. So hands like this, head propped up, legs at 45 degrees, helps nourish the back. So yeah, hand like this, and all you're gonna do is you're essentially just gonna open up that hip, and you're gonna feel it in the outside of the hip here. The reason this is important is because it's stabilizing those glute muscles. We sit for too long. So if you're desk-based, if you're traveling a lot, those glute muscles are gonna be very lazy. I mean that in a nice way. But what we need to do is wake those glutes up. We're saying, glutes, come on, let's go. Let's put some pressure onto the hip. Let's drive that extension from the base of the spine, as well as going through the hip joint. So make sure we're taking pressure off your back and also the hip as well. So anything from sort of 10 to 12 reps of this, and obviously you're gonna swap over and do it on the other side. So that's that's called a clamshell exercise. There's a lot of different names for it, but we just call it a clam because you're opening up that clam like this. Make sure you're supporting your neck, not letting the neck drop down too much like that. The other one that I love is just the ability to be able to move the hip joint. So I like to do the alphabet. Remember, you're not moving the knee or the foot, you're moving the hip. As a byproduct, the knee will move, the ankle will move. Hold on something on the side. I'm gonna try and draw the alphabet. I'm gonna go for little alphabet on my leg. Now, what this is gonna do, C as well, and then D. You see what word I'm doing? And then E like this. So you might want to get bigger with the hip as you swoop it down like this and then come back over, and then going out to the side as well is always good to nourish that hip. Now some of these movements may be painful. We've got to try and avoid those. But what I'm trying to do here is I'm trying to nourish that ball and socket joint to allow to get some lubrication through there. So if you've got very mild hip arthritis or you've got some twinging in the hip and you've been diagnosed with that, this is going to be a great exercise to keep that hip moving, just nourishing the joint, just causing some flexibility through those areas. So just start small like this, and then gradually get longer sweeping movements as you start to draw those letters around. Anything for 30 seconds, and try and repeat that 3 times is going to be really good to help with those areas. Okay, and then here's a bonus one. So if you're trying to wake up those glutes, let's say you've got pressure in the base of the back here or come around the side of the hip, and you're not too concerned about any hip arthritis, but you're just trying to get more stability in your hips. Maybe you love walking on the weekends, maybe you love playing golf or cricket or tennis, and you're trying to get some more stability in your legs, just to help with any knee pain as well. This is a great exercise to do. So legs completely straight, and you're just trying to move that leg up, hold it there and come back down. Take a breath. Hold it there and come back down. So anything from 10 to 12 repetitions, 3 sets is great for those hip stability exercises. Okay, so there we go. There's some things to get started with finding out if you do have any hip problems. More importantly, finding out if you've got early onset hip arthritis, thinking that you may. That's obviously not going to definitively tell you if you do. You're going to need an expert opinion, you're going to need an x-ray, someone who knows what they're talking about to find out exactly what's causing your hip problems. So try and find someone there. If you need any help, just drop a comment in below. I'll be able to recommend someone closer to you if you're in the UK or Europe. Second thing is, you've got some exercises there to start with to ensure you're increasing that stability through the base of your spine and helping your hips. This is going to help keep your hips healthy long term, prevent any arthritis. So I thank you for watching today. As always, if you like the video, please hit the like button, subscribe to the channel. It helps us to give more healthy information to the rest of the viewers on YouTube. And we've got a book here as well to transform your life. You can grab a copy of my best-selling book, this one, and also The Secret Cure to Back Pain on Amazon in the comments below. Thanks very much.